Welcome back, and thank you for joining us. Let's begin with a simple question. Have you ever woken up after a full night's rest, 7 or 8 solid hours, only to feel completely drained? Like your energy has vanished before the day even begins? You might chalk it up to getting older, stress, or just another long week. But what if that deep, lingering fatigue isn't just a passing inconvenience? What if it's your body, more specifically, your heart, sending you a warning? Today, we're diving into 8 silent but critical signs that your heart may be in trouble. These aren't dramatic collapses or sudden chest pains like we often see in movies. Instead, they're the quiet signals, subtle, persistent, and easy to miss, that could point to serious cardiovascular problems if left unchecked. If you care about your health, or the health of someone you love, this is a message you can't afford to ignore. So stay tuned as we count down from sign number 8 to the most urgent warning of all at number 1. You might just learn something that could save a life. Sign 8. Unusual fatigue. Let's begin with one of the most commonly ignored warning signs, unusual fatigue. This isn't the kind of tiredness you feel after a long workday or restless night. It's a deep, lingering exhaustion that doesn't improve with rest, one that leaves you feeling drained even after a full night's sleep. You might notice that simple, everyday activities like walking to the mailbox or doing light chores suddenly feel overwhelming. You wake up tired, you feel worn out by midday, and there's a fog over your thoughts that just won't lift. When your heart isn't pumping blood as effectively as it should, your body's organs and muscles don't get the oxygen they need to function properly. And that can leave you with a sense of fatigue that's difficult to explain, but impossible to ignore. What's even more concerning is that this sign often shows up well before a serious cardiac event. In fact, many women experience this type of persistent tiredness weeks or even months before a heart attack, often without any chest pain at all. So if you've ruled out common causes like poor sleep, anemia, or thyroid issues, and you still find yourself unusually exhausted day after day, it's time to take a closer look at your heart. Listening to your body could make all the difference. Catching these early signs might not just improve your quality of life, it could save it. Sign 7. Shortness of breath. Shortness of breath may seem harmless at first, but it can be one of the earliest signs that your heart is struggling. You might find yourself winded after climbing a single flight of stairs, or needing to catch your breath after walking a short distance. Sometimes, it's even harder to breathe while lying flat, forcing you to prop yourself up with pillows at night. These aren't just signs of being out of shape. When your heart isn't pumping efficiently, blood can back up into the lungs, causing fluid buildup and congestion. That extra pressure makes it difficult for oxygen to circulate through your body, leaving you breathless, even at rest. This breathlessness can show up in different ways. Exertional dyspnea, struggling to breathe during light activity. Orthopnea, feeling short of breath while lying down. Paroxysmal nocturnal dyspnea, waking up gasping for air in the middle of the night. These symptoms are often mistaken for asthma, allergies, or aging, but the longer they're ignored, the greater the risk to your heart. If you're experiencing any of these signs regularly, it's important not to wait. A simple echocardiogram or other diagnostic tests can reveal if your heart is the underlying issue. Your breath is one of the body's most immediate warning signals. Pay attention to it before a quiet symptom becomes a loud emergency. Sign 6. Irregular heartbeat. Have you ever felt your heart flutter, skip a beat, or suddenly race for no apparent reason? While it might seem like a passing sensation, an irregular heartbeat, also known as arrhythmia, can be your body's way of alerting you to a deeper heart issue. These episodes can feel like a light fluttering in the chest, a strong thump, or a racing pulse that takes you by surprise. Although occasional palpitations can be harmless, frequent or unexplained changes in your heart's rhythm, especially when paired with symptoms like dizziness, fatigue, or shortness of breath, should never be ignored. Your heart relies on a finely tuned electrical system to beat in a steady, consistent rhythm. When this system is disrupted, the result can range from minor irregularities to conditions like atrial fibrillation, AFib, a common but serious arrhythmia that increases the risk of stroke and heart failure. Some common causes behind these irregular rhythms include electrolyte imbalances, high blood pressure, overactive or underactive thyroid, structural abnormalities in the heart, undiagnosed sleep apnea. What's especially concerning is that these symptoms often appear when you're resting, relaxing, or even sleeping, making them easy to dismiss or forget. If you notice any of the following signs, it's time to check in with your doctor. Fluttering or pounding in your chest, skipped or extra heartbeats, lightheadedness or feeling faint, fatigue that seems to follow episodes of palpitations. Simple tests like an electrocardiogram, ECG, or a Holter monitor, which records your heart's activity over 24 to 48 hours, can help identify arrhythmias before they cause more serious complications. Your heartbeat is your body's internal rhythm. When it's out of sync, your overall health can suffer. Don't brush off these signals. Your heart may be asking for help. Sign 5. Swelling in the feet and ankles. At the end of a long day, have you ever looked down and noticed your feet or ankles appear puffy or tight? While occasional swelling might seem harmless, caused by hot weather, long periods of standing, or even salty food, it can also be a subtle but serious signal from your heart. Persistent swelling in the lower legs, feet, or ankles, especially if it improves slightly by morning but returns each evening, may indicate peripheral edema, a common sign that your heart is struggling to pump blood efficiently. Here's what's happening. When the heart's pumping ability weakens, blood flow slows and begins to back up in the veins. This increased pressure causes fluid to leak out of the blood vessels and into surrounding tissues, especially in gravity-dependent areas like the feet and ankles. This isn't just fluid, it's a message from your circulatory system. Common signs of this kind of swelling include pitting edema, when pressing your finger into the swollen area leaves an indentation that lingers. A sense of heaviness or tightness in the legs, shoes fitting tighter than usual, especially toward the end of the day. This symptom is often associated with right-sided heart failure, but it may also signal chronic venous insufficiency or more generalized cardiovascular issues. What's important to remember is that this swelling might be your body's early attempt to tell you something is wrong, well before more dramatic symptoms develop. The good news? When identified early, this issue is often manageable. Lifestyle adjustments like reducing salt intake, elevating your legs, using compression socks, and taking prescribed medications can significantly ease symptoms and protect heart health. So don't ignore that puffiness or brush it off as just part of aging. If your swelling becomes routine or worsens over time, it's worth discussing with your doctor. It could be one of your heart's earliest cries for attention, and acting early can make all the difference. Sign 4. Persistent cough or wheezing. We often think of coughing as something harmless, a lingering cold, seasonal allergies, or maybe a touch of asthma. But when a cough sticks around longer than expected, especially when it's wet sounding, worse at night, and doesn't respond to typical remedies, it might be more than a simple respiratory issue. It might be your heart. When the heart, particularly the left side, isn't pumping blood effectively, it can cause fluid to back up into the lungs. This buildup is known as pulmonary congestion, and it can trigger irritation in the airways, leading to persistent coughing, especially when lying down at night, wheezing, or a whistling sound when exhaling, shortness of breath that worsens during rest or sleep. Many people don't associate a cough with the heart, and that's what makes this sign so easy to overlook. Instead, they reach for decongestants or assume it's allergies. But unlike a seasonal bug, a heart-related cough won't go away with over-the-counter meds. It lingers, it often worsens, and it can be the body's way of whispering that something isn't right with the cardiovascular system. There's one common clue to watch for. If propping yourself up on extra pillows at night helps relieve the cough or breathlessness, it's a strong indicator that the issue may be cardiac rather than respiratory. To uncover the true cause, doctors may order a chest X-ray, echocardiogram, or BNP blood test, each designed to detect signs of fluid buildup and assess heart function. The sooner you recognize this red flag, the better. Left untreated, fluid in the lungs can lead to worsening heart failure and significantly impact your quality of life. So if your cough has outstayed its welcome, especially if it gets worse at night, don't just assume it's harmless. It could be your heart's quiet call for help. Sign 3. Dizziness or lightheadedness. Have you ever stood up quickly and suddenly felt the room spin? Maybe your vision blurred for a moment, or you felt like you might faint. While this can happen occasionally due to dehydration or standing too fast. When dizziness or lightheadedness becomes frequent or unexplained, it could point to something more serious, your heart. Your brain depends on a steady flow of oxygen-rich blood to function properly. When your heart can't deliver that blood effectively, you may begin to feel off balance, disoriented, or even at risk of blacking out. Several heart-related conditions can cause this drop in circulation. Arrhythmias, where your heart beats too slowly or irregularly. Cardiomyopathy, a weakening of the heart muscle. Valve disorders, which can disrupt blood flow patterns. And in more severe cases, aortic stenosis, where the valve narrowing blocks blood to the brain during activity. These problems can result in sudden drops in blood pressure, inadequate oxygen reaching your brain, episodes of fainting, also known as syncope. This symptom is particularly concerning in older adults or individuals with existing conditions like high blood pressure, diabetes, or a family history of heart disease. Unfortunately, many people ignore it, blaming it on fatigue, hunger, or just being tired. But dizziness is not something to brush off. It's your body's way of saying that your heart may not be keeping up. If these spells are becoming more frequent or happen without an obvious cause, it's time to speak with a healthcare provider. Diagnostic tools like an electrocardiogram, ECG, a Holter monitor, or a tilt table test can help identify the root issue. Remember, even subtle signs like lightheadedness can reveal major concerns beneath the surface. And the sooner we listen, the better the outcome. Sign 2. Chest discomfort. When it comes to your heart, any kind of chest discomfort should never be taken lightly. We often imagine a heart attack as a dramatic, crushing pain, but in reality, the early warning signs can be much more subtle. You might feel a dull, lingering pressure, a tightness that wraps across your chest, a burning sensation, easily mistaken for indigestion, or a feeling of heaviness, like something is weighing you down. These sensations might show up during physical activity, under stress, or even while resting quietly. And while they may seem mild or come and go, they could be your heart's way of waving a red flag. One common cause of this symptom is angina, pain or discomfort that results from reduced blood flow to the heart muscle. It's often a sign that your coronary arteries are narrowing or becoming blocked. And though angina isn't a heart attack itself, it's a serious warning that one could be on the horizon. Other serious conditions, like pericarditis, inflammation of the heart's outer lining, or aortic dissection, a tear in the heart's main artery, can also cause chest discomfort, each requiring immediate medical evaluation. The message is simple but vital. Even mild chest discomfort should never be ignored. If you've experienced this kind of pressure or pain, no matter how small, talk to your doctor. Diagnostic tools like stress tests, ECGs, or imaging scans can help uncover what's really going on behind that discomfort. When your heart speaks, even in a whisper, it's worth listening. Sign 1. Severe chest pain or pressure. When it comes to heart health, no warning sign is more urgent or more dangerous than severe chest pain or pressure. This isn't just a dull ache or a fleeting discomfort. It's the kind of pain that stops you in your tracks, intense, crushing, and impossible to ignore. Many describe it as an elephant sitting on my chest, a vice tightening around my heart, a deep, burning sensation that won't let go. This pain doesn't always stay in the chest. It may radiate to your arms, jaw, neck, or back, especially on the left side. It's often accompanied by cold sweats, nausea, lightheadedness, or a sudden feeling of doom. These are classic signs of a heart attack, or what doctors call an acute myocardial infarction. Here's what's happening. A coronary artery has likely become blocked, cutting off oxygen-rich blood to part of the heart muscle. Without that oxygen, heart tissue begins to die, fast. And in these moments, every minute counts. It's critical not to wait, not to rest and see if it passes, and definitely not to drive yourself to the hospital. Call emergency services immediately. Thanks to modern medicine, treatments like clot-busting drugs, angioplasty, and stenting can save lives, but they only work if you seek help in time. Unfortunately, Many lives are lost not because the condition couldn't be treated, but because people waited too long to take action. So if you, or someone around you, experiences this kind of severe chest pain or pressure, don't hesitate. Call for help. Act fast. Your quick response could mean the difference between life and death. Let's take a moment to recap the 8 critical warning signs that your heart may be in danger. Unusual fatigue, persistent tiredness that doesn't improve with rest, shortness of breath, especially during light activity or while lying down, irregular heartbeat, fluttering, skipping, or racing sensations, swelling in feet and ankles, fluid buildup in the lower extremities, persistent cough or wheezing, especially at night or when lying flat, dizziness or lightheadedness, unexplained balance issues or fainting, chest discomfort, dull pressure, heaviness, or a tight feeling, severe chest pain or pressure, intense, radiating pain that signals a heart attack. Each of these signs may seem small on its own, but together, or even alone, they could be your heart's way of calling out for help. Don't ignore these symptoms. Don't wait for them to worsen. If even one of these feels familiar, it's time to speak with a healthcare professional. Early detection and prompt treatment can make all the difference, and may even save your life. If you found this video helpful or eye-opening, we kindly ask, right finger give it a thumbs up to help others discover this vital information. Right finger subscribe to our channel and turn on notifications so you never miss practical, easy to understand health advice. Right finger share this video with your loved ones, because one simple share might help someone catch a warning sign early. Your heart is more than just an organ, it's the engine that powers your entire life. Let's protect it together. Thank you for watching, for caring, and for choosing to stay informed. Until next time, take care of your heart, and it will take care of you.